Hi, everyone. Great to meet you. My name is Jordan. I am a licensed marriage and family therapist from right here in San Francisco, and I specialize in working with people who are affected by chronic illness and chronic medical conditions. So this is what I will be going over today. Brief overview of mental and emotional considerations, stages of going through a chronic illness, and a lot of what I will be talking about today are the challenging parts of dealing with a chronic illness, but I will also be talking about the hope, the strength, the community that is in this journey as well. So first, the stages of living with chronic illness. I'm going over just two kind of prominent stages and any emotional and mental considerations that may come up during these. So first we have diagnosis, and diagnosis could be a complete shock to you if you did not have any symptoms beforehand. It could also maybe be a relief if you have been trying to find answers to your physical symptoms. But whatever it is, a diagnosis really changes your life, and there's a lot of emotions that come with it. And after those emotions or with them, there is now the now what feeling. Okay, what do I do next? What treatments do I go for? What are the next steps? When do I have to make my appointments? All of that. And during those action stages, sometimes emotions are maybe pushed aside, or sometimes they are all-consuming. But there are a lot of emotions going on with diagnosis. And with a diagnosis as well, you also may dealing with the label of now you are a person who has glaucoma or a person who has vision loss. And you may feel like you need to grapple with, what does this label mean for my life, and how is this going to affect me moving forward? And the preparation stage, of course, you're anticipating treatment, preparing your body and mind for treatment, telling your loved ones, and just getting ready for the next steps. Then we have adjusting your life. So it's really important to remember that adjustment is a continuous process. It is not a destination. You will be continuously learning, growing, and changing throughout this process, and it is okay to continuously alter your needs. There's a lot of new with a diagnosis. You have to adjust to this new reality. There's new treatments, there's new appointments, there's new medication names that you probably need to wrap your head around. There's a lot of changes in expectations, and I will talk about grief and loss shortly. But grief and loss really starts kind of soon after a diagnosis, because you do have an adjustment of expectations in how you thought your life would look like, and that is really hard to grapple with. Vision is, of course, something that most people have, is something that you have relied on, maybe taken for granted in your life, and now that reliability and that ability is changing. That is really, really challenging. You may also have a change in routine. You make preparations for the next steps. You're learning skills and tools to best support you. Small daily habits such as cooking yourself a meal or reading the paper may need to look different. There also may be a change in relationships. So people in your life may not show up the way that you thought they would following a diagnosis, and that is very challenging to deal with. There may also be challenges in connection, intimacy, maybe feeling more socially isolated, or just having more difficulty in navigating social dynamics. And of course, a change in future plans. You may not know what the future holds for you. You may have to, of course, adjust your life in various ways, adjust your future, but remember that you can still fully engage in life. You can keep your dreams and goals active, but they just may look a little different, and that's okay. So here are some mental and emotional considerations that can be present through all stages of this journey. It's really important to remember that any and all emotions are very valid when going through something like this, and you can allow your emotions. Give yourself grace for them. Also, many emotions can coexist at the same time. So you can have gratitude with grief, you can have hope with loss, many, many emotions. And a lot of these are uncomfortable, but they are natural reactions to what you're going through. So you can give yourself grace and space for that. And I will go over some ways to healthy emotionally process in a bit. So here are some emotions that may come up throughout this journey. And emotions that you feel during this time, they could be expected or they could be unexpected. So there can be a lot of anxiety, and that comes with the basis of uncertainty, of just not knowing what the future holds, not knowing what your life can look like, or feeling out of control. There's also a lot of anxiety, stress, and overwhelm, of course, with the changes in your routine and the adjustments that you have to make to your life. There's fear of what your life will look like, what it will be like to lose your vision, how that will physically and mentally affect you. There's fear in the vulnerability that comes with the loss of a physical ability and how you will change with that. And again, there could be relief in finally having a diagnosis or relief in having treatments available for you. And that can often be an unexpected emotion that comes up. There could also be a lot of anger, frustration, and confusion, the feeling of why me? Why did this have to happen to me? This is unfair that I have to change my life now. And those are very, very valid feelings. Also, depression is very common when going through a medical challenge or an illness. And that is because you are going through an uncontrollable illness and you may feel helpless in the face of that. And again, grief. So grief does not have to just be death, but it can be a loss of physical abilities, loss of expectations. Grief is a very, very natural reaction to loss. And a big challenge that is very common with people who are dealing with medical challenges is that sometimes you may feel that your identity is shifting. There's a lot of loss in that, and that can elicit a lot of the emotions that I said on the last slide. So not feeling like yourself anymore. That could be because of physical changes. Vision loss may get in the way of some aspects of your identity. For example, if you identify as an artist and now maybe you can't create art in the same way you used to, or you identify as an athlete and maybe you can't engage in sports in the same way that you want to. That is very, very challenging. Also, other senses may be strengthened. Smells, sounds, maybe stronger. Touch or pain is more sensitive. You're dealing with the physical sensations of treatment. There's a lot of vulnerability in that, but there's also a lot of strength in how your body adapts. And it could be kind of interesting and cool if smells and sounds are stronger. There's also potentially a perspective change that is very common when going through illness. Your priorities and values may be different now. Things that were important to you now seem irrelevant. You may have a greater sense of gratitude, purpose, a different way of moving through the world. It is okay to adjust your values and perspectives through this journey. You are going through a different, new experience, so of course you are going to change with it. And a very challenging part of living with a chronic medical condition is the effect that it has on your loved ones. You may feel a lot of guilt because you need more from others. You may be asking for help more. You may just have more challenges that they are watching you go through. You may need to communicate your needs differently to your loved ones. Or you may feel like you're not able to connect as you once did. These are all very normal and, of course, very challenging. There may also be role changes with maybe you were the caretaker, you were the one that was always taking care of others, and now you're the one that has to be taken care of. So very, very difficult, normal for these relationships to change, and it's so important to have open communication with your loved ones and remember that your needs can always be changing and adjusting. And independence. You may feel a little less independent than you're used to, and also you can learn to be independent in so many different ways that you did not think were possible. You may have to learn to advocate for your needs more if that's something that you're not used to. And it's really important to remember to advocate for your needs with providers as well, with your family, with your friends. You know your body best, and you can speak up for yourself. So now I will go over some coping tools, ways to manage all the challenging emotions that I just mentioned. First, mindfulness and grounding techniques, which Dr. Lin talked about meditation, so that was really wonderful to hear. But mindfulness and grounding techniques are very important to recenter yourself, refocus, and maintain control, especially when there's a lot of uncertainty, overwhelm, stress, and anxiety going on in your mind. So breath work is very important, and with breath work, You want to remember to inhale through your nose if you can, exhale through your mouth, and always try to exhale for longer than you inhale because that sends a calming signal throughout your body. So if we can all try that together, you can take a deep inhale through your nose and exhale through your mouth. Okay, great. And meditation. So there's wonderful meditation apps out there. There's also free meditations on YouTube. You can do meditations on your own as well. It doesn't have to be a guided or a program, but you can just scan your body and release tension throughout your body by yourself. You can say mantras in your mind to yourself, and that can be a form of meditation. You can also engage your senses. So engage in what you can hear, what you can smell, taste, and touch. And that's a really great way to recenter and bring your mind to the present. And then progressive muscle relaxation. So that is when you tighten muscles in your body, actively tighten, and then actively release. And that sends a signal throughout your body to calm. And you can do that by pretending you have a stress ball in each hand or a piece of fruit, and you're trying to make juice out of the fruit, but just really tense and then relax. And in conjunction with mindfulness tools, it is very helpful to have a values-based and present-focused thinking. So when you observe your own thoughts and you actively try to think in a different, more helpful way, that's actually creating a new pathway in your brain. And so it can really make your brain a more peaceful, calm mental space to be in and make those big feelings of uncertainty and anxiety and depression feel a little less powerful. So focusing on the present and what you can control, you may feel like you do not have control over your illness, over your loss of vision, but you do have the power to engage in activities that are joyful, calming, and meaningful for you. So for example, exercise, listening to music, getting outside, journaling, you can still do all of those things, even if there are some adjustments that you need to make. And moving towards your values. So whether your values are new ones that you've developed throughout this journey or they're old ones that have been inherent to you, you can continue to be creative in how you move towards those values, but always know that you have the power and you have the abilities. And letting go of should thoughts. So being aware of how many should thoughts come into your mind. And examples of those could be, I should be doing this, I should be doing more of that, or I shouldn't be feeling this way. And you want to acknowledge those and try to let go of those, because letting go or challenging these should thoughts will help to give yourself more grace to feel all of the emotions that you can and to be really present in where you are at. And helpful versus unhelpful thinking. So a great way to know if something is helpful or unhelpful is how it makes you feel. You know that unhelpful thoughts don't make you feel good. And so when unhelpful thinking comes up, for example, if a thought comes up that says, ugh, I'm useless now that I can't work as well as I used to, then instead you want to reframe or challenge that thought to instead say, I still do what I can. I'm still me. I'm learning to adjust and adapt. Or with challenging the shoulds, instead of saying, I shouldn't be feeling this way, you can challenge that or reframe that to say, it is okay that I'm feeling this way. I can get through this. And finding support. The Glaucoma Research Foundation has amazing resources for counseling and support, peer-to-peer programs, community resources, of course, like this. But it's so important to find that area of support for yourself in whatever way that is. So that could be individual counseling, and that's really great because you have a space just for you outside of friends and family where you can really just let all the emotions out, not feel that guilt, not feel that burdening, and you can get tools that are really specific to you. Support groups are incredible because you are in a room with people who really understand what you're going through. And you can have a lot of shared resources, learn tips and tricks, new tools, new developments in technology, just so much value from support groups. And then, of course, seeking out local and national organizations, peer-to-peer programs, exploring new technology and tools and resources. There's so many books, podcasts, social media. There's so much out there now. And so it's really just about, you finding the agency in how you want to support yourself, and you can find that and you can have that support so you don't feel alone. So some final things to remember. If you take away anything from this talk, please remember these: that all of your feelings are valid. Adjustment to life with illness is a continuous journey. You are still you, and you have control in your life. Advocate for yourself, and you are not alone. Thank you, everyone.